Bismillahirrahmanirrahim. We are discussing about functions of the hypothalamus. Last time we discussed some of these functions. We discussed its functions in the control of autonomic nervous system, control of water balance of the body, control of food intake, feeding, hunger, control of feeding reflexes by the hypothalamus, and then control of the uterine contraction and milk ejection or milk let down. We discussed about the control of the body temperature by the hypothalamus, and then control of the anterior pituitary secretions by the hypothalamus through releasing and inhibitory hormones. And then we discussed about the role of hypothalamus in the sleep and wakefulness. Today the next function is control of the sexual function. Control of the sexual function. Hypothalamus along with other parts of limbic system, especially amygdala, is involved in the control of the sexual function. So hypothalamus along with the other parts of the limbic system, especially amygdala, is involved in the control of the sexual function. When hypothalamus along with the medial forebrain bundle, is stimulated in males, there is erection in males along with the behavior changes, In monkeys, when there is bilateral removal of amygdala, there is oversexuality. So there is oversexuality when in monkeys there is bilateral removal of the amygdala. There is oversexuality in monkeys when there is bilateral removal of the amygdala. So this is function, that is the control of the sexual function of the body. The next function of the hypothalamus is control of behavior and emotions. Control of behavior and emotions, such as fear, rage, feeling of reward or pleasure. Emotion has got two aspects. So there are two aspects of emotion: mental aspect and physical aspect. The mental aspect of emotion consists of cognition, affect, and cognition. Right? So the mental aspect of emotion consists of cognition, affect, and cognition. Cognition. Say there is a bomb blast. Or explosion. The person is able to recognize there is a bomb blast or bomb explosion. This is the cognition. The person is able to recognize that this is the bomb blast. And then the effect. Effect is that the man is frightened. The man is frightened due to bomb blast. And then there is conation. That is, the person wants a shelter. The person wants a safe place. So on hearing the bomb blast, the person wants to hide himself in a safe place. Right? This is called conation. Right? So these are the stages of the mental aspect of the emotion. Then comes the physical aspect. Physical aspect of the emotion is that there are changes in the viscera and skeletal muscle. Changes in the viscera and skeletal muscle. Say, person runs away from the site of the bomb explosion, hide himself in a safe place. So there are changes in the viscera and skeletal muscle. Now these changes in the viscera and skeletal muscle require coordinated activity of the autonomic nervous system and somatic nervous system. So these changes in the viscera and skeletal muscle require coordinated activity of the autonomic nervous system and the somatic nervous system. So this is the physical aspect of the emotion or behavior. Now in the hypothalamus and other parts of the limbic system, in the hypothalamus and other parts of the limbic system, there are two types of centers. Two types of centers which help in the regulation of behavior and emotion. So two types of centers in the hypothalamus and other parts of the limbic system which help in behavior and emotion. The first center is punishment center. Punishment center. And second is reward center. Punishment center and reward center. Now first of all, the punishment center. This center is located in the perinuclear zone. Perinuclear zone of the hypothalamus and thalamus. So in the perinuclear zone of the hypothalamus and thalamus, and then in the periaqueductal gray matter. In the periaqueductal gray matter, the gray matter present around the aqueduct of Sylvius in the midbrain. The gray matter surrounding the aqueduct of Sylvius in the midbrain. This is the periaqueductal gray matter or central gray matter in the midbrain. So in these two areas, the perinuclear zone in the hypothalamus and thalamus and periaqueductal or central gray matter around the aqueduct of Sylvius, there is punishment center. When this center is stimulated, there is fear. And that is manifested by tachycardia, increased heart rate, tachypnea, increased respiratory rate, pupillary dilatation, piloerection, cutaneous vasoconstriction, sweating, and maybe tremors. Maybe tremors. Now when we stimulate this center for punishment, the features are there is tachycardia, tachypnea, pupillary dilatation, sweating, cutaneous vasoconstriction, piloerection, and tremors. So these are the features manifested when there is fear. Fear due to stimulation of the center for punishment. Right? So when this center for punishment, center is strongly stimulated, then there is rage in animals. So in animals, when we stimulate this center strongly, there is rage. And in the animal, what changes occur in the rage? The animal adopts a defensive position. The animal adopts a defensive position, extends claws, पंजे फैलाता है, extend claws, lifts the tail, spit and growl, and the animal may attack on slight provocation. Along with that, there is pupillary dilatation, opening of eyes. So when this center for punishment is strongly stimulated, the animal develops rage. And what are the features of rage in the animal? The animal adopts a defensive position, extends the claws, lifts the tail, spit and growl. There is pupillary dilatation, opening of eyes, piloerection, and the animal may attack on slight provocation. So these are the features of rage. Right? I told you that the center for punishment center is located in which part? In the periventricular zone of the hypothalamus, thalamus, and in the central gray matter or periaqueductal gray matter in the midbrain surrounding the aqueduct of Sylvius. Less potent centers for punishment are present in the amygdala and hippocampus. In the amygdala and hippocampus, the center for punishments, which are less potent centers for punishment, are present. Then there are reward centers in the hypothalamus, and these reward centers are in the lateral and ventromedial nuclei of hypothalamus. So in the lateral and ventromedial nuclei of hypothalamus, there are reward centers. When reward center is stimulated, the animal gets feeling of reward, feeling of pleasure. So when reward center is stimulated, the animal gets feeling of reward or feeling of pleasure. So these two centers for punishment and reward center, these were discovered during research on animals, say monkeys. Now a monkey was kept in a cage. And micro electrodes were placed in different parts of the brain. Micro electrodes were placed in different parts of the brain, including the center for punishment and reward center. And these microelectrodes were connected to a stimulator, and a handle was provided in the cage of the monkey. So microelectrodes were placed in different parts of the brain, including the center for punishment and reward center. It was connected to a stimulator, and the lever, a handle, was placed in the cage. Right? Now the animal, the monkey, by chance pressed the handle which stimulated the center for punishment. The animal, by chance, pressed the handle or lever, resulting into stimulation of the punishment center. So the animal gets feeling of punishment, displeasure, and the animal then avoided pressing the handle or lever in the cage because he got displeasure, sense of punishment, so he avoided further pressing of the lever or the handle. Now if the handle was pressed continuously, the animal became sick. If the handle was pressed continuously, the animal became sick. Now at the other occasion, the connection of stimulator was with the microelectrodes in the reward center. The microelectrodes were in the reward center. These were stimulated. So microelectrode in the reward center was stimulated. The animal got a feeling of pleasure and reward. The animal got feeling of pleasure and reward. So the animal started pressing the handle again and again. The animal started pressing the handle again and again because the animal was getting reward, feeling of reward, feeling of pleasure. So he started pressing the lever or handle in the cage again and again. And the animal even neglected food intake. He neglected food intake. He was getting pleasure and he started pressing the handle, lever again and again. So in these experiments on animals, monkeys, these two types centers were identified. The one thing to keep in mind is that those sensory experiences are remembered. Those sensory experiences are remembered which are accompanied by punishment or reward. So those sensory experiences are remembered which are accompanied by punishment or reward. If anybody is punished, it will be remembered. If anybody is rewarded, it will be remembered. So it means hypothalamic centers for punishment and reward help in the memory process. So hypothalamus center for punishment and reward, these help in the memory process. Now these two types of centers, center for punishment, reward center, these are also present in human beings. The experiments in humans suffering from schizophrenia and epilepsy have shown that similar centers are present in human beings. Center for punishment and reward center are present in human beings. Normally, there is a balance of the activity of the center for punishment and reward center. So normally there is a balance between the activity of center for punishment and reward center. See, when there is overstimulation, overexcitation of the center for punishment, there will be rage. The animal gets, or the human being gets rage when their center for punishment is strongly stimulated. And when you stimulation involves the reward center, then the person becomes soft. The person becomes soft when there is stimulation of the reward center. So this was about the function of hypothalamus, that is the control of behavior and emotions. Our next function of hypothalamus is control of circadian rhythm or biological clocks. Regulation of circadian rhythm or biological clocks. You know, certain parameters, certain aspects in the human body, they show diurnal variation. Biological clock or circadian rhythm. Say body temperature. Body temperature is minimum in the early morning and higher in the evening. Body temperature is minimum in the early morning and higher towards evening. There is cycle of sleep and wakefulness. Cycle of sleep and wakefulness. A cycle of secretion of corticosteroids. Say in the early morning there is increased secretion of ACTH and corticosteroids. So in the early morning there is increased secretion of ACTH and corticosteroids. There is also diurnal variation of the count of eosinophils. There is also diurnal variation of the count of eosinophils. Also diurnal variation in the secretion of melatonin. Secretion of melatonin also shows diurnal variation. And keep in mind, there is melatonin secretion during darkness. So during darkness, there is melatonin secretion. Right? So these circadian rhythm or biological clock is controlled by hypothalamus, especially the suprachiasmatic nucleus. So controlled by hypothalamus, especially the suprachiasmatic, nucleus. So in the anterior hypothalamus, this nucleus is present, which is suprachiasmatic nucleus, which controls the biological clocks, the cycle of sleep and wakefulness, secretion of the melatonin, ACTH, corticosteroids, body temperature, then the count of eosinophils. So it is controlled by the suprachiasmatic nucleus in the anterior hypothalamus. So this was about the functions of the hypothalamus. Now about the functions of the amygdala. Amygdala is another important part of the limbic system. So functions of the amygdala. It is involved in olfaction. And this function is more important in animals. It is more important in animals. involvement of amygdala in the control of the sexual function. So in the control of sexual function, there is involvement of the amygdala. So when this is stimulated, there will be excitation of the sexual activity. There is also involvement of the amygdala in the control of behavior and emotion. So in the control of behavior and emotion, there is involvement of the amygdala. Involvement of the amygdala. So affection, control sexual function, and control of behavior and emotion. Now when there is a bilateral destruction of amygdala in monkeys, there is Kluver-Bucy syndrome. There is Kluver-Bucy syndrome when there is bilateral destruction of the amygdala. Right? So Kluver-Bucy syndrome results when there is bilateral destruction of the amygdala. Now in this Kluver-Bucy syndrome, what are the features? The features are that there is oral tendency. Oral tendency. The animal puts everything into mouth. The animal puts everything into mouth. Even the things which can't be eaten, these are put into the mouth. There is oral tendency. The animal puts everything into the mouth, even which can't be eaten, these are put into the mouth. Then changes in the behavior of the animal and may become tame, soft, loss of aggressiveness in the animal and become tame. There is over-sexuality. There is over-sexuality in the animal. And then there is change in the behavior of the animal regarding food intake. The animal which is herbivorous becomes carnivorous. The animal which is herbivorous becomes carnivorous. The animal who take only the vegetable, non-meat diet or herbs, they take meat. So animals which are herbivorous, they become carnivorous. So this was about the functions of the amygdala. Other important function of the limbic system component is hippocampus. So functions of the hippocampus. Hippocampus is involved in the control of behavior and emotions. Involved in the control of behavior and emotions. Weak electrical stimulation of hippocampus. Weak electrical stimulation of the hippocampus results into an epileptic seizure or fit. So we stimulate the hippocampus with weak electrical stimulation. Result will be an epileptic fit or seizure. So during this epileptic fit or seizure, there are various types of hallucinations. So during the epileptic fit or seizure, there are different types of hallucinations, such as visual hallucination, tactile, auditory, olfactory. So there are hallucinations which may be tactile, visual, auditory, and olfactory. What is hallucination? Feeling of something which is not present actually. The patient feels something which is not actually present. Person may see something which is not actually there. The patient may hear some noise which is not there. The person may smell something which is not there. Person may feel something on the body which is actually not there. So these are the hallucinations which accompany the epileptic fit or seizure produced by the weak electrical stimulation of the hippocampus. In some patients of epilepsy, hippocampi have been removed and the patient got benefit. So improvement in patients of epilepsy by removing the hippocampi. When you remove hippocampi, there is benefit, improvement in patients of epilepsy. So when there is a bilateral destruction of the hippocampi, there is anterograde amnesia. Anterograde amnesia. Anterograde amnesia when there is destruction of the hippocampus. It means hippocampus is involved in the recent memory. Involvement of hippocampus in the recent memory. And when we destroy hippocampus, the result will be anterograde amnesia, that is the loss of recent memory. Loss of recent memory. The person is not able to remember the name and faces of the persons to whom the patient meet. Right? So the patient is not able to remember the name and faces of the person to whom he comes in contact. Right? So yesterday the patient met with some individuals, and if you ask the name and faces of those person is not able to remember. Moreover, the patient is not able to learn new skills, new events. Person not able to learn new skills. Now keep in mind that a person's remote memory is intact. The skills which were learned before, these remain intact. But new skills cannot be remembered in this patient of anterograde amnesia. So this was about the hippocampus. Right? Next, briefly about the hypothalamic disease. Hypothalamic disease. What are the causes of hypothalamic disease? Causes of hypothalamic disease. The cause may be inflammation, a tumor, and vascular disorder. Vascular disorder, thrombosis, hemorrhage, so vascular disorder. Now, what are the features of the hypothalamic disease? Features of the hypothalamic disease. Features include obesity. Obesity is present in patients with hypothalamic disease. Obesity. In a few cases, there may be wasting, but mostly there is obesity. obesity. Then sexual functions are disturbed. In children, there is sexual retardation. In children, there is sexual retardation. In adults, in males, there is impotence. In males, there is impotence. And in females, there is amenorrhea, loss of the menstrual cycle. There is amenorrhea in females. So in children, there is sexual retardation. In males, there is impotence. And females, there is amenorrhea. Other feature is hypothermia, increased body temperature. So hypothermia or increased body temperature. The other feature is irresistible, intense desire to sleep during daytime. So irresistible, intense desire to sleep during daytime. So during daytime, person has intense desire to sleep. It can't be resisted. And this remains for, say, seconds to minutes. It remains for seconds to minutes. This disorder is called narcolepsy. Narcolepsy. This narcolepsy, intense desire to sleep during daytime, which cannot be resisted. It remains for, say, seconds to minutes. Right? This is called narcolepsy. Intense desire to sleep during daytime, which cannot be resisted. It remains for seconds to minutes or even longer. The other feature in this disease is disturbances of behavior. Disturbances of behavior. There may be rage, uncontrolled behavior. Maybe rage, uncontrolled behavior. There may be unexplained weeping. Unexplained weeping. Unexplained laughing. So unexplained weeping and laughing is present in these patients. And then the other feature is that if the hypothalamic region involves supraoptic nucleus, if hypothalamic region involves supraoptic nucleus, then there is diabetes insipidus. Diabetes insipidus when the region in the hypothalamus involves the supraoptic nucleus. So these are the features of the hypothalamic disease: obesity, hypothermia, sexual retardation in children, impotence in males, amenorrhea in females, disturbances of behavior, emotion, rage, unexplained weeping, unexplained laughing, narcolepsy. Right? Then there is diabetes insipidus if the region involves the supraoptic nucleus. This was for today. Thank you.